stress and neurodevelopmental disorders. First, I would like to give a brief description about the concepts of stress from the pathophysiological perspective. Stress has been defined as a state of threatened homeostasis by Walter Cannon in his book, The Windsong of Body, and he first described the role of catecholamines, epinephrine and norepinephrine, or adrenaline and noradrenaline, in the stress system activation, and he described the fight or flight response. And some years later, Hans Selye, who is considered as the father of stress, in his book The Stress of Life, he described stress as a general adaptation syndrome, and he introduced the role of the hypothalamus, the pituitary, and the adrenals in the stress response. He also has introduced several other terms, such as stress or distress. This presentation have three parts. Of course, it's a very huge, it's a very wide topic. So the first one is the effects of prenatal maternal stress on neurodevelopment, which is the most crucial because during in the recent years, several studies have shown that prenatal stress has effects on child neurodevelopment and behavior. The second part is the functioning of the stress system in individuals with neurodevelopmental conditions. And the third one is a more epidemiological one about the effects of the COVID-19 pandemic in children with neurodevelopmental disorders. This was an international collaboration published very recently, so I would like to show you some global results. Stress has different effects in the lifespan. During the prenatal and the period and the first years of postnatal period, stress has a very powerful role because of the programming effects on brain, and specifically in these areas, the amygdala, the frontal cortex, and the hippocampus, through the actions of glucocorticoids. In adolescence and in adulthood, the effects of stress are less crucial. And during these first years of life, stress can change these basal brain structures and have potentially long-term effects in the lifespan. In this figure, we summarize the role of early life stress. Early life is prenatal and early postnatal, and the role of stress in stress-related behavioral and health conditions. Now, this is a review from our team summarizing the role specifically of early life stress in the pathogenesis of neurodevelopmental disorders, given a specific genetic predisposition. Stress can be measured through using questionnaires. These questionnaires can be stress-specific, such as the perceived stress scale, questionnaires of anxiety or depression, clinical interviews, and also biomarkers such as cortisol, alpha amylase in saliva and hair. And these biomarkers represent the end effectors of the stress system activation from the axis that I described previously. And the most appropriate methods of measuring stress is to combine behavioral and biological data. There are several studies now showing that the effects of stress in the prenatal period may impact they may have effects on in the development of neurodevelopmental disorders as a group. And first, stress can be related to premature delivery, to preterm birth, and to small birth weight, conditions that we know that have an increased risk for all neurodevelopmental conditions. Several studies show that prenatal stress has been related to a great percentage with premature delivery and with increased risks for low birth weight, both conditions that have a direct effect on neurodevelopment. Other studies have shown that irrespectively of the birth weight and the prematurity, maternal prenatal stress has been related with adverse neurodevelopmental outcomes. I present here several studies showing that life events, multiple stressors, stress measured here. I have two tables. In this table, I have the behavioral data, self-reported stress or stress reported through clinical interviews, and the outcomes. These outcomes are regulatory problems in infants, externalizing, internalizing problems, ADHD, depression, autism and schizophrenia, autism, and ADHD again. And in this slide, I summarize the biological data, stress as expressed with increased cortisol levels during pregnancy and the outcomes. This first study shows that anxiety and cortisol levels during pregnancy and the combination of both scales or interviews and biological data is stronger, has been associated with the volumes of gray matter in prefrontal and temporal lobe and in children 6 to 9 years old, and increased volume of the right amygdala and emotional problems. In other studies, cortisol and anxiety have been have been shown to be predictive of anxiety, have been associated with child temperament and with emotional responsiveness and with mental and motor development. Just to mention here that this systematic review compares the biological and the behavioral methods in assessing stress, and they conclude that the biological measures may be more indicative of stress as predictors of adverse infant outcomes. Some neuroimaging data here. This is a study investigating the effects of maternal exposure to childhood maltreatment, which is an extreme stress, traumatic stress, on newborn brain anatomy. And this study shows that exposure to maltreatment in mothers has been related to smaller volumes of gray matter in children. And another study, a prospective association of maternal psychosocial stress in pregnancy with newborn hippocampal volume and implications for infant social emotional development. In this figure, we see hippocampal volume and perceived stress during pregnancy. This is the right and the left hippocampus. And then in the third slide, we see the correlations between hippocampal volume and the Bayley scores, the scores on social emotional in the Bayley developmental test. The mechanisms, the pathophysiology of the relations between prenatal maternal stress and infant or child outcomes can be categorized, these mechanisms, to those related to psychosocial characteristics, such as anxiety and depression, and their biological effects on the biological characteristics, which are the increased mediators of the stress system, the biophysical, it can be obesity and other metabolic changes. We know, for example, that diabetes, gestational diabetes during pregnancy has been related to autism and other neurodevelopmental conditions, and behavioral characteristics related to stress, such as smoking, alcohol, and medication. And of course, the thyroid function is crucial for neurodevelopment. This is, we know this from several years. And of course, maternal prenatal stress also has a great effect on the thyroid function of mother. And with the increase of all these biological mediators that cross the placenta, the brain of the fetus changes and may, of course, in relation with the genetic predisposition, this may lead to increased rates of neurodevelopmental disorders. This is a whole issue that we have published, and we and others have published several studies on stress and neurodevelopment. And now I will present some data of the second topic, which is the stress system activation in children with neurodevelopmental conditions. In general, the stress system is activated during stress. For example, in individuals with anxiety or depression, the stress system has been shown to be elevated, as assessed by increased stress-related biomarkers. In autism and ADHD, we have diverse data. For example, most studies in children and adolescents with ASD show higher biomarkers, higher cortisol, and higher responsiveness of the HPA axis, and higher function of the sympathetic nervous system, which is very important because, and in the clinical practice, we see that many children are very stressed and they may perceive the world in a different way, very stressful and very, and maybe feel fear. So maybe this diverse perception of the world may be related to the increased state of the increased biological markers of stress in a chronic basis. On the other side, several studies, I present studies from our group here in children with ADHD show a different response. The stress system has been shown to be hypofunctioning. For example, cortisol and catecholamines in many studies have been shown to be lower than usual. And this is a low stress response to perceived stressors of the environment. This has been shown to several studies. And in this paper, we also examine the relations between parenting stress of mothers of children with ADHD and cortisol level in children, and we found a correlation between parenting stress of mothers and cortisol levels in children. Another study here examining children with ADHD, ASD, learning disabilities, and typical. And here also we see changes in stress responses of children with autism and ADHD. Here we try to examine the effects on an academic performance test and on a moral cognition task. And now the time is limited. I would like to present some epidemiological data. These data do not involve biomarkers or stress markers, but this is This is a study from several centers. We had 1,275 children from 15 centers worldwide. You can see here that most centers are from Canada, United States, Greece, Italy, and Ireland. So in this multi-center study, we investigated the global effects of the first wave of the COVID pandemic in mental health of children and adolescents with autism and other neurodevelopmental conditions. This paper has been now published in Molecular Autism, and so the findings were very diverse. So we divided the groups to children having a broad symptom worsening, to those had a primarily modified service, those having primarily lost services, and those with the average services symptoms or symptom changes. You can see that only the 20% had the broad symptom worsening, which is not consistent with small studies showing that that children experienced a very negative condition, and that they had several adverse effects. The time is limited, so I will show you the results. Here there are the predictors: pre-pandemic school services, pre-pandemic outside school services, the government stringency and the lifestyle stress, COVID worries had the most important predictors of the outcomes. And here is Greece. You can see that the broad symptom worsening group is small here in Greece. Of course, this is the first wave of the pandemic. These are the centers in the United States and Italy. And just to summarize this data, we show that the elevated perception of COVID-related risk, pandemic-related lifestyle stressors, predicted more negative outcomes in youth with NDD or ASD. Age and the set of NDD ASD specific parameters that must be considered collectively to provide a meaningful picture of a pandemic impact in this population. In middle childhood, a greater number of baseline services may foster resilience during a disaster, and also that in middle childhood, if living in areas with greater restrictions at times of COVID-19 rates, continuing services, even in modified format, this may lead to a relatively more stable clinical profile. So these findings are in contrast with earlier ASD studies, smaller, suggesting that pre-existing challenges or symptom severity were associated with greater impairment during the pandemic. And this is the material that we translated from the World Health Organization. This is a guide, the guide Doing What Matters in Times of Stress, that have been developed during the pandemic. And this is the Greek version that we hope that could be useful in families experiencing stress. Thank you.